2 of the worst chiropractic clinic in the United States. If you haven't seen the first part yet, go watch it because it will give you important information to better understand what's coming next.
Because I sure could use a fixing. As they say, you are as young as your spine is flexible.
It's a nice expression, but it's not entirely accurate. Some people, due to their genetics, have a more rigid spine. Similarly, some people have tendons, muscles, and ligaments that are stiffer than average. On the other hand, some individuals are very lax, even to extreme cases like Ehlers-Danlos syndrome, where connective tissue is so loose and deficient that it can lead to vascular, cardiac, and joint problems. For example, people with the vascular type of EDS may have fragile blood vessels, increasing the risk of vascular ruptures and aneurysms, as well as cardiac complications. Ligament laxity often results in frequent sprains, dislocations, and subluxations, as the joints are overly mobile and less stable. This opens the door to chronic, persistent pain caused by instability and repeated microtraumas. But to clarify the main point, you can be as stiff as a tree trunk and still not develop any health issues.
But in my profession, one-star reviews are not something I can be flexible with. I need to experience the service for myself.
Hi.
I'm Taji.
Taji?
Yes.
Hi, Taji, Dr. Rodriguez. Did I
So
pronounce
nice
right?
to meet you, yes.
Taji?
Thank
Okay,
you so
got
much
it.
for having me today. Dr. Rodriguez took me back to his treatment room for a consultation so he could get an understanding of my physical issues.
So, what do we need to fix on you?
Once again, we absolutely don't fix anything with conservative treatments like chiropractic, physiotherapy, massage therapy, osteopathy, and even less with alternative holistic treatments.
So I've had a lot of back pain. I dislocated a shoulder skateboarding a long time ago, so back here it kind of hurts. My back, like even kind of back here now hurts. Definitely some like, I don't know what you call that, if it's like early arthritis or what, but kind of like tension here. This knee's actually pretty tight, this back knee right here.
Right, okay.
For some time down here it was like really messed up, but now it's kind of gotten better. So once in a while, like I do get a little thing from that. I don't know if it's a migraine or what it is, but sometimes towards the end of the day, it'll just start aching, but nothing too pressing.
Am I the only one who feels that this chiropractor thinks it's too much and that he doesn't care at all?
Everything that I do is designed to get you well as quickly as possible with as few visits as possible.
What we generally suggest is that during the first 3 visits, you should observe a subjective improvement in your symptoms of about 30 to 45%. This particularly applies to acute conditions that have just manifested. The improvement will be more moderate for those that have persisted for several weeks without falling into the realm of chronic pain.
So what we want to do is we want to fix you. But the best way to fix you is to find out what's causing your problem.
This phrase makes me uncomfortable every time I hear it. It suggests that there is always a specific cause for your symptoms, which is not always true. People who use the expression "finding the source of your problem" often attract desperate patients, giving them hope of discovering an explanation that the traditional healthcare system has failed to identify. Often, these individuals rely on pseudo-scientific concepts and generalizations to make you believe they have an answer that no one else could provide. It's important to be cautious about this because the majority of neuro-musculoskeletal pain episodes are non-specific. They are simply instances of non-specific tissue sensitivity, and I find it dishonest to promise patients that we can always identify the precise cause of their pain.
Is to find out what's causing your problem.
Of course, in the case of a serious injury, such as a strain or ligament injury, it is possible to determine the cause with a good degree of certainty. But in most cases, pain arises without a major incident, in an idiopathic manner, after a wrong movement or poor posture. These pains are generally not related to a displacement, blockage, or damage to the body's structures. Remember, non-specific pain is multifactorial, extremely subjective, and complex to understand.
Dr. Rodriguez had me do a series of stretches to get a clearer picture of what was going on with me.
These are not really stretches, but rather range of motion tests that are generally conducted after an initial consultation. These tests follow the analysis of vital signs and precede orthopedic or neurological examinations in order to assess the function of the affected areas. The goal is to determine if these tests help clarify the diagnosis. Certain conditions of the neck and back, such as facet joint irritation or torticollis, can lead to functional losses, such as difficulty turning the head. These are non-specific diagnoses.
So you have body inflammation. Body inflammation.
Saying you have inflammation everywhere is not a diagnosis. Inflammation is a symptom that often follows an injury, and in some severe cases, it is the result of rheumatologic diseases like rheumatoid arthritis or ankylosing spondylitis. These conditions attack the body's tissues, leading to inflammation, pain, and even joint destruction. In the case of ankylosing spondylitis, the spinal ligaments can even turn into bone. It's unfortunate because for many therapists in North America, especially among chiropractors in the United States, it's hard to imagine pain or sensitivity without attributing it to a misaligned vertebra, a blocked joint, or inflammation. Pain is subjective and unique to each individual. Everyone experiences pain differently, and it's simply a signal used by the brain to prompt you to take preventive actions, such as movement or physical activity. These actions improve your neuro-musculoskeletal endurance and can also temporarily help you avoid painful movements. Never forget that physical activity and movement not only help ease discomfort, but also make persistent pain more manageable.
Just with a few touches, Dr. Rodriguez already had the beginnings of a diagnosis. Was he a master chiropractor, or were the reviews true?
After him just laying 2 fingers on me all over, he said he was done.
If you don't crack anything, can you even call yourself a chiropractor?
He totally cheated me.
That should have broke my index finger. Even the muscles of your back are weak. Okay, this is the reflex for hormone. I don't treat anything. Ugh, nuts.
Wow.
I just made you gluten intolerant.
So you're not evil.
We'll wrap up the video here because we're starting to dive into a hot topic, even in Canada, applied kinesiology. The link for the next part of this video should appear now. In the meantime, feel free to share your story, your comments, your suggestions, or just let me know if you still have any questions.